One of the problem that I've been in practice for since 1997, and as a physician, we do not have good handwriting, or we put a lot of stress on other things. But when we comes to writing down notes, we don't spend as much time writing or making documentation. So a lot of time complaints from other staff, even other providers. Was that, doctor, I cannot read your handwriting, and I would have to tell them what I wrote down. So we did going EMR, or having electronic medical record keeping was extremely important. So we started looking into it even before we found out that we would be mandated at a certain point by regulation to go for having complete EMR. So I started looking into it about close to 2 years ago. At that time, I did not know that there was a regulation. So I looked into several programs, and yes, there are good programs, but I was specifically looking for a program that would accommodate a psychiatrist's need, that I can change things, I can make a template for my needs, and a patient. Psychiatric practice is a little bit different than general physician. So when I went through different research process, I did find program. They may have one thing, but the other element was missing. So I did spend some time to see what program would meet all or most of our needs. So when I was introduced to American Medical Software, I liked it about a year ago, but I was thinking that maybe I would find a comparable or better product. First time when I thought about having AMS was about a year before I actually had it. And so even after knowing about American Medical Software, I continued my research that I would find something better. And again, I would repeat myself saying that this was the best product that I could find that meet all our needs. And I've been using it for some time now, and I found it very user-friendly, as I was explained to me when I was sold this product. And so I think it has worked for me the way I wanted it to work for me. When you're going for a system, you are promised a lot of things, and that this will happen. But what I've seen with American Medical Software, that whenever I need something or I have a question, I will pick up the phone and I'll call, and they are very good to help me out. If there's any glitches, they will help me learn how to solve the problem, or they will solve it for me. So I'm very comfortable in using the system, that even if I get into a problem, I can pick up the phone and call somebody to help, and I will get the help. Well, number one, ease of using prescription. E-prescribing is very important to me. The reminders are very important when things are due. I get a reminder, so I don't have to put a reminder or sticky notes for myself for certain things. We can communicate among staff. So my check-in person send a message to me that patient has certain need, and I can communicate to a patient, make a documentation, and all staff know about it. So that is very important to me. I think it has cut down our office associate time, so they can do other things.